Hi, we're here in Sierra Leone. This is our first day. And over here we got Mohamed Jalloh. Now, Mohamed Jalloh has played a very big part in this whole mission. When we were here in 2019, I came across Mohamed Jalloh at the first hospital I went to. Isn't that right?
Yeah.
Yeah, Myamba.
Yes, Myamba Government Hospital.
Yeah. And Mohamed Jalloh, what were you? You were like, was it nurse? Health? Or what was the actual title?
I was a nurse by then.
Nurse then.
Yeah.
And the idea was that he comes and assists me for the 2 weeks, and then we just go back and everything's back to normal.
Yeah.
However, Jalloh decided to take an interest, and then I picked up on that, and the rest is history. So we taught him how to place anesthetic, we taught him how to extract teeth, and he carried on running the clinic.
Yeah.
And we stayed in touch on WhatsApp, exchanged information and assisted, and that set the tone for how things were going to be. So from Myamba Clinic, we moved on to Kamakwe.
Yes.
And then Kamakwe went to Bond and Bond Island. Yeah, so that's 4 clinics we've started.
Yes.
And you are an inspiration.
Thank you.
I'm going to move over to Mohamed Jalloh now to tell us his story.
Okay. Hi, everyone. I'm Mohamed Jalloh. I'm a nurse in the Myamba Government Hospital. I first met with Dr. Radi in 2019. It was May 2019, May.
Yeah.
So I worked with him for 2 weeks. During that process, I learned a lot. He taught me to give anesthetic, to do tooth extractions for that period of time. We spent 2 weeks together. So when he left, I thought it fit that this is an opportunity for me and an opportunity also for my community, because by then there were nobody there. The place was vacant. The person that was assisting people passed away months ago before you went there. So after you left, I said, okay, let me make use of the knowledge that I've got from you. So I started running the clinic. Day by day, patients started coming. At times, I would see 1 patient a day, at times 2. Okay, so I said, okay, let me continue. So I continued doing it for over 6 months. And the news gets spread all over the community, is the nearby villages. So people started coming in. And I said, okay, this is a very good start. So I keep informing you, giving you updates, how the clinic is going on. Okay, with that, I thought it fit to come to Freetown. So I discussed it with the MS, the medical superintendent that was there by then,
Mm-hmm.
So I discussed it with him, and he thought it fit that, yeah, it's a very brilliant point that I want to come to Freetown and spend some time and go back. So I came to Freetown and spent some time with Dr. Kamara.
Is that when you did your therapist course?
Yes,
Yeah.
yes. So I spent some time with him.
Dr. Kamara being the head of the...
the principal dental officer.
That's right.
So I spent some time with him. And that is where I went back after a period of time, after a year. Let me say after a year.
In Freetown?
Yes. So I went back. I started running the clinic again in the very huge standard now, based on new equipment he sent for us. So I started running the clinic. I go in for more equipment, like getting scalers, try to get some instruments that were not available, like tweezer, probe.
So you were able to do more treatments then, not
Yeah.
just extractions?
Yeah, we'll do tooth extractions, we'll do tooth cleaning, scaling and polishing.
And eventually fillings?
Yes, and eventually we'll do fillings presently.
Which is great, because like occasionally you'd have like young people coming in with a very simple problem,
Yes.
but in pain on the front tooth, and the only option we had when I was there was to pull the tooth out.
Yes.
But now you offered them even more options.
Yes, but then when you left, after my period of time in Freetown, when I went back, I said, okay, now let me implement another system. Because before was tooth extraction, when patient come, we'll do tooth extraction, I said it fit that, okay, now there are parameters that will lead to tooth extraction. So now I'll be looking at my parameters to assess this tooth, whether it will be necessary for me to extract it or not. So I thought it fit that if I continue extracting tooth, within 1 or 2 years, the people around my community will find it difficult, because multiple tooth extractions.
You have other problems then?
Yes.
Like?
The patient will lose his face, the shape of his face.
Yeah.
The symmetrical proportion of the face will be dislocated.
Yeah. And difficulty eating.
Yeah, difficulty in chewing, difficulty in speech.
Yeah.
So I thought that, okay, I need to stop the multiple tooth extraction. Now I started introducing fillings.
Wonderful.
Yes, I started introducing fillings. I got my chair, I got my arm piece.
Yeah.
Yeah. So
You've got a nice little dental unit there now.
yes,
Complete.
Yes, complete.
Providing comprehensive service.
Comprehensive services is
It's absolutely
provided.
wonderful.
Yes.
And you also got some news for us, because I believe in a week's time.
Yeah, in the week's time, by the special grace of God, if Allah make it possible, I will travel to Cyprus
Too.
to do my further studies in dentistry.
So that's wonderful. So you're
Yes.
actually going across to do a full-blown dental course.
Yeah, exactly. In a period of 5 years. Yes, which is supported by you.
You're more than worthy. You're more than worthy. You know,
Thank you,
and
sir.
I'm honored actually to be part of your journey.
You're welcome. I'm really, really happy because this is what I've been praying for in the past years. This is a very big opportunity that has to change my life, change the life of my family, my community, because I believe in my return, something huge is going to happen in my community.
I think so.
Yeah,
I
because
think
there are times, all these bike riders around our communities they got accidents. At times they got mandibular fracture, maxillary fracture. There is no way to sort those things out. But I believe after my period of time in Cyprus, when I return, I'll be able to sort out all those things, which my community will be very, very much proud of. Because since it's the history of that community, you are the first dentist that established a clinic there. You are the first person. So always, even our paramount chief always ask for you. You remember the teacher that went there and said, "Oh, Mister, I'm in haste. I want to go to school. Can you
Yes.
please assist me?"
Yes.
Yes. That teacher always ask for you.
So nice.
Yes, he always remember about you. We are so proud of you in the community because you really start a life there. Because the previous times, people die because of tooth abscess.
Yeah.
People die. So since then, when you went there, after your return, the death rates really minimize because I will assess and say, okay, let me don't do filling, let me do tooth extraction just to save the person from abscess. Because, in our community, with time, I've been able to convince people because, since in the east of that place, they don't know anything about dentistry. So all the knowledge that they have about it is that when they have problem, they go in search of this orthodox medicine. They'll visit the native people, they'll give them something to rub, they'll hit some native herbs and give them to put in their mouth. With there at times, all those will lead to dental candidiasis, and it will cause a lot of problem, mouthwash, angular cheilitis, all those problems, they get it from this hot and orthodox medicine. But since you went there, and I continue the sensitization. We sensitize them, we go to the radio stations, we try to sensitize people, we go to the marketplaces. I have photos of those areas. I'll go to the marketplaces, we visit the local communities around the nearby villages, we talk to them, we educate them. That when you have problem with your tooth, you go to the hospital. Don't go to these native herbs. Because these native doctors, they don't know anything about tooth. They don't know anything about the mouth. Or anything about the mouth. So when you go there, they will just use their common knowledge to see whether they can give you something that will subside the pain. So after multiple times of sensitization, they started coming. So we try our level best to give them the best service that they need. So the death rate has really, really, really minimized. And even there are times, this abscess will even lead to lubric's angina.
And we see them coming. I remember we used to see them coming through the clinics.
Yes.
We couldn't do anything for them at that stage.
Yes.
Bone necrosis, stuff like that. And
Yes.
we're talking about bone necrosis of the whole mandible.
Of the whole
Not
mandible.
just of a localized area.
Yes.
It was really sad.
There was a time I sent you a patient which has an epolis.
Yeah.
Yes, and the woman with that epolis case, I made a refer and sent her to Dr. Kamara.
Uh-huh.
So he did the surgery and it was successful.
Wonderful.
Yes, the surgery was 100% successful. So he went to our village. After a period of time, she sent 2 people to me of that same condition.
Right.
So when they came, I did another refer and sent them to Dr. Kamara. He did the surgery because there are times when I refer those patients to him, he will give his best.
Yes.
If even they don't have much money, but he will not look at the money. He will look at how best he too can assist because the knowledge of dentistry in that area is very, very small. So we give his best at least so we can try to encourage them. So when they come to the hospital and they get the best, when they go, they will deliver the message again.
This is it.
And
This is it.
more people will come.
This is it, exactly.
Yes. So he also is doing very, very, very well. He's doing very, very well.
He's a good guy, and he supported us.
Very, very well.
He has supported us, so to be fair.
Yes,
He's
yes.
allowed me to come along and do what I want to do what I need to do,
Yes, he's very, very
with
supportive.
his blessings.
Yes, yes.
Which isn't always the case in many countries.
Yes,
You know,
yes.
sometimes they just stand in your way. But he's done the opposite, which
Yes.
and we have to commend him for that.
Yeah, because yes, he has visited Myamba, I think twice.
Yeah.
Yes.
I remember once with the TV crew when they opened officially opened up the clinic.
Exactly. He visited Myamba by then, and later he went there again.
Yeah.
He even took us to an area in my main area,
Yeah.
Sierra Leone.
Uh-huh.
You remember Sierra Leone?
Was that nearby?
At Moriba Town.
Yes, yes.
The
yes.
place you stays when you go to Matthew John.
Yes.
Sierra Leone.
Yeah.
So he took us there in the community.
Right.
So we went there, we do some tooth extraction free.
Oh, outreach.
Yes.
One of the outreach projects.
Yes.
Yeah.
Yes.
Free
Yes.
extractions and everything.
Yes.
Yeah.
So he has been trying really. Has been trying.
And that's the thing. I mean, it's not that you're just based in hospital. Because of your skill set, you're able to go into really, really remote areas.
Yes.
And we've been together
Yes.
to really remote areas, and we've just had some simple equipment and been able to carry out, in effect, potentially life-saving procedures.
Yes, because he even assists us with a mobile chair.
Yeah.
A portable
Yeah.
mobile chair that
Yeah.
we use
Yeah.
most of this time to go there.
What's going to be really interesting is what we were talking about earlier. You're going to go to North Cyprus
Yes.
Dental School.
Exactly.
Is it, what's the dental school called?
Cyprus International Dental School.
Cyprus
CIU.
CIU.
Yes.
Okay. As a first-year dental student, yeah, we're having a little laugh about this, and you've probably extracted more teeth than any of the lecturers or professors in that school. that's I mean, you know, and not just that, you've had to work under probably conditions that they might have worked in for maybe like an outreach, but not on a day-to-day basis. So you're working under conditions, limited conditions, having to compensate what your equipment with using your skills, your minds, you know what I mean? Thinking outside of the box, yeah? And I think, you know, as a result of that, when you complete your studies, that is going to make you a very, very robust individual.
Exactly.
Do you know what I mean?
Yeah.
Because people come out of dental school, they've got the knowledge to a point, the basic knowledge, right? And then they need years to develop the skills. Whereas you're going in reverse in a way. Obviously, you're going to learn new skills, and obviously you're going to advance in the other aspects of dentistry. You know, like your endodontics, like your periodontics, and also like your restorative, yeah? But then, you know how dentistry is like feel and touch, isn't it? And you know if something feels right, doesn't feel right, how much pressure you can put, for example, when you're extracting a tooth. And this comes on for many, many, many years, yeah? You've already established that side of things. So hopefully it's, with your studies, things are going to come together so strong.
Yeah.
So strong, you know, and hopefully, I mean, you know, you're going to be an asset to this country. You're going to be an asset to the school when they realize, you know, when you finally get onto clinics and they realize what you can do.
Yeah.
You know, so I'm excited. I'm excited for you, and I'm excited to follow you as well and see where this takes us.
Okay, thank you so much. You know, before I say anything, going to Cyprus is my dream, and I say thanks to you.
My pleasure.
Because it's due to your support that God has made it possible that I will be leaving by next weekend. All my documentation I've done, my visa, everything is okay now. You know, this is what I've been praying for, as I said earlier, because I don't want my dream to die. I don't want my dream to die. I have passion for the medical field. I started it, and when you went there, you introduced me to another sector, which is the dentistry department, and I was so happy. So after so many years of practice, since 2018 till now, 2023, I thought it fit that I've got a lot of practical experience from where we started. So I said, okay, let me don't be static. I need to push further so that I can achieve my goal. So I thought it's fit that let me discuss it with you as I did earlier, and you accepted.
I remember when you sent me the request.
Yes.
I was taken aback and I thought, wait a minute. This isn't such a crazy request to go to dental school after all.
Honestly.
This is probably the best money spent,
Yes.
you know?
Yes. Because like investing in people is better than requesting for something that you just use for a period of time.
That's right.
But just as what you are doing now, investing in me, I think would be a very big blessing to me, my family, and my country also. Because in this country, as far as I'm concerned, we have not only 3 doctors that are working for government.
Yeah.
Yeah, the dentists. We have only 3 dentists that are working under government.
For 7 million people.
For 7 million. We are above 7 million people now.
Yeah.
Which is very, very, very terrible. But I believe after my period of time in Cyprus, when I return back, I believe I will deliver something huge. And going to Cyprus, I think I have a very big advantage because of the practical experience that I have. I will only be focused on the theoretical areas to see how I can strengthen my practical aspects. Because whatever you're doing practically, you need to have a theoretical knowledge over it. Because if you are talking about dentistry, you talk about the head and the throat specifically, and which is one of the key parts of human being. I really need to improve on myself. Maybe in the future, I will choose another specialty area in the dentistry, like being an orthodontics. But I pray for something huge.
When you come back, you have to train the next generation.
Oh, that would be excellent. I will do that.
Our dream of having units all over the country.
Oh, you know, my dream is that when I come back, we'll establish a dental center.
There you go.
Yes.
There you go.
Yes, I believe in that. Because, you know, the part of the world that we are living here, the knowledge of people is very, very small in dentistry. You know, there are so many areas in this country which we lack of. Dentistry is one. Ophthalmology areas. These are areas that people do have knowledge of. They really do have knowledge over it. But as far as my own area now, dentistry, I think I'm going to achieve my dream.
There's going to be changes.
Yes, there will be changes.
There's a storm coming.
Yes, because, you know, because one of these days I've been thinking a lot that, okay, this point in time I'm going to leave my family, I'm going to Cyprus. It's okay, for a period of 5 years, I'm going to miss my family a lot. But I'm going for a very big goal that I need to achieve. So I will throw everything back and see how I will focus my mind to achieve. Because, you know, there are times in every single part of life you expect some difficulties. You must expect difficulties. But I'm ready to face whatever challenges that I will be facing.
And you're well prepared.
Challenges are meant to be facing. You not run from them, but you find a way to sort them out. You know, in leaving your country to another country for the very first time, you have a lot of challenges. You know, there are so many areas that you get challenges for. Because as for me, in focusing on my studies, reading, going for class, I don't have problem with that. I will make sure I give my 100% best.
Because you're representing Sierra Leone.
Yeah.
How many people are going out and doing dental school at this point in time from Sierra Leone? Not many.
Not many.
Maybe
Not
just
many.
you.
Yeah. Because even my guy there, he's not doing dentistry. So I think for now I'm the only one going.
You've got broad shoulders. You can hold that burden.
Yeah.
You will be fine. I think we should also mention the fact that we should have a special kind of appreciation to Professor Charles Senese, who
You
was
know,
a lead
Professor
legislator.
Charles, you know, talking about Professor Charles, that is where I want to end
Yes.
our discussion. But let me just start there now, since you have mentioned his name. You know, my life, I say thanks to Professor Charles, because since day one I came across with him, it has been excellent. He always gives his time. He always responds to messages.
He always picks up the phone.
Always.
I've never phoned him and he hasn't picked up the phone.
I'm so happy for him.
Yeah.
He always gives his time to people.
Yeah. Because now he's the Deputy Health Minister. Well deserved. Well deserved.
100%.
Yeah. Everyone's happy to have him there.
Yeah.
And we can see the changes already.
There are a lot of
We can
changes.
see the changes already.
Very, very active.
Yeah.
Hardworking.
Yeah.
You know, he always creates room to get views from people. You know, since I knew him 2018, I've never called him, he doesn't pick up.
Yeah.
He always makes sure he pick. If even he missed my call, he will call me later.
Yeah. And you know, when I speak to him and I need him to talk to one of you guys always report back to me that he's actually called you straight after I've finished the conversation.
Okay.
You know, so it's really nice. He doesn't dwell on things or anything. He wants to get things done.
Yes. He wants to get things done. He's really straightforward. You know, even this program, I discussed it with him. He said, okay, I can give my best. And he asked me, have you discussed it with Dr. Radi? I said, yes. He said, what did he say? I said, okay, I have made a request and he has approved my request. And he said, that's good. By then, he was in Sweden by then.
Yeah, he's still in Switzerland. Yeah.
Yes. So he said, okay, now this is what Dr. Radi have said. I said, yes. He said, okay, let us look for means which we use to solve this issue. And I said, okay, fine. He sent me to 1 or 2 places which I believe with his support things will work well. Because presently I'm happy because he's the Deputy Health Minister. And I pray that he will give his utmost best for me to achieve what I'll be going for. You know, I always appreciate him because as a brother, because he's a Sierra Leonean, we are proud of him in this nation. This nation is very, very proud of him. Because if you guys are coming here today, I think he's one of the pioneers for you guys to be here.
He is, yeah.
Because you have been coming every year.
Yeah.
Because we are here last year again.
Yeah, every year I can come.
And you guys are always ready to give supports.
That's
you know, to help a country as a whole, not even a district, but a whole country, I think is a very big tax.
But it's a country with a lot of potential.
Yeah.
People potential. And that's the first thing I noticed when I came here. People like yourself.
Exactly.
Yeah. And like Alpha, the surgeon.
Oh, yes.
Yeah,
Alpha, the surgeon. Yeah. Yes, I still remember him.
Man.
He stays at McKinney now.
Right.
Bombalidis.
Incredible.
Yes. He stays
I think we better wrap it up there.
Yes.
Yeah. Because I could talk. We could talk forever. We could talk forever because this guy is a fascinating guy. It's a fascinating country and fascinating people. And he's just one example of many people out there with so much potential that just needs a little bit of a break in life, you know? And imagine if these other guys got the same break that Mohamed Jalloh got, where would be? Where the country would be. Yeah? But I'm sure when you come back, you're going to give a break to a lot more other guys, aren't you?
Yeah.
To follow in your footsteps.
Exactly.
I'd like to thank you
You're welcome.
for being who you are and where you're going. Yeah? Well done. Well done.